Hey everyone, thank you so much for subscribing to my YouTube channel. I hope you're finding the information healthy today. I wanted to talk about therapists. So I consult with clinicians who are looking for input and insight on how to handle certain cases. And I was talking to one of my colleagues who said, I've been seeing this couple for about 4 years, and they really, they just don't seem to be able to get healthy. And I'm a little bit worried about them. And, I'm not sure who the abuser is. And so I immediately said she should take my clinician attorney coach training. It's 14 hours with 14 CEs, but it's also offered self-study at a very low fee. And, the idea behind it is to educate people on what this can look like. When people show up in our office and there's conflict, quote unquote. There's anxiety, there's depression, there's all of these relationship dynamics going on, or someone comes in individually and they're filled with anxiety and they're filled with overwhelm. We immediately assume there's something wrong with them. What if there's something wrong in their history, whether it's their family history, child abuse, or maybe bullying throughout life, or maybe an employer, or maybe their relationship, their partnership. There's something wrong in the partnership. And so I think the number one rule needs to be rule out abuse. Let's like really talk about, is there abuse going on in this family system? Is there abuse that's occurred in the past? Has it occurred in someone's life? I was talking to another client, 27-year-old, who disclosed to me that she had been sexually abused or sexually assaulted at the age of 16. She'd never told another therapist. That isn't about me. I'm not trying to suggest that I'm a better therapist. What I'm trying to suggest is I asked the right questions. And if we don't ask the questions, what is going on in your life? Who are the people that influence you? I always talk about like this idea of an echo map. Like you put yourself in the center, and then you put like a circle, and then you put a bunch of circles around there, and you put everybody you know, good, bad, and ugly. You put them all around, and then you ask yourself, how are people contributing to your life? Who's bringing transformation to you, and you're bringing transformation back? There's a reciprocal relationship. If that is not happening, is the relationship transactional and harmful? That's the other question. It can be transactional, maybe not harmful. Dr. Ramani and I discussed this, right? There are narcissists who are, yeah, I mean, it's hard to get along with them. It's really challenging, and but these people, some people may not be abusive, right? And then there's narcissistic abuse, there's coercive control, there's people who are like a 10 on the spectrum. And as she and I always discuss, the people, the moms that I help, the dads that I help, the people suffering coercive control, relationship dynamics, they are dealing oftentimes with people who are truly intent on causing harm. They want the other person to feel harm. It's a game for them, right? And so I want to say again that as therapists, if you're in therapy, have you done an assessment? As a therapist, have you done assessments on your clients to figure out what the relationship dynamics are in their life that may be causing anxiety, depression, borderline quote unquote behaviors, right? All of the things that could be going on in someone's life that could be actually really harmful to their ability to handle life, right? And so, what can we be looking for? And what can we be educating our clients on? Or what can you ask your therapist to support you on? Because you know that they should be rolling out abuse first. So I hope that's helpful, everyone. Please remember to subscribe. If you know a clinician or an attorney or a coach who might be interested in taking the training, again, it's offered self-study. A whole attorney office could take it for a very low price, and it would be very helpful for them to understand the process. The self-study version is like 7 hours long. I'm really trying to get the word out there. It's not just what is domestic violence. It's what is the underpinning of all abuse. It's coercive control. And so we really have to ensure that professionals understand this. Thank you. And be sure to listen to my TEDx. Have a great day. Bye.